The Musimi Task Force report was a product of negotiations between 6 union members and 6 government officers. The task force was aimed at raising standards of healthcare in public institutions, but no attempt has been made to implement this report.
I can assure you, Minister of Medical Services has never read this report.
The report proposes the construction of a county referral hospital in each county, complete with medical equipment and diagnostics. The need for resources to bring an end to perennial deficits in medicines and other supplies in the facilities. Recommendation of a constitutional amendment forming a health service commission dealing with matters of health personnel in the country, and payment of 92,000 shillings monthly stipend to self-sponsored registrars working at Kenyatta, Mathare and Moi referral hospitals.
Doctors, power! Power!
With no negotiations between the union and government officials, Medical Services Assistant Minister Kazungu Kambe says the return to work formula signed between government and doctors last year has already been implemented and their accusations are baseless.
This strike is not about a pay increase. It's a strike to ensure that the public sector infrastructure reforms that was agreed on in the Musimi Task Force report is implemented and implemented to the letter.
Other issues pending outside the Musimi report include a collective bargaining agreement that was ignored and negotiations called off. The government only employed 57 doctors of the agreed 200. The government has not been paying fees for government doctors undergoing specialized training or registrars as they are commonly referred to. And lastly, a partial payment of call and extraneous allowances to all doctors in public service. The union now says it will mobilize other health personnel next week if the government fails to address their demands. For News at 8, I'm Rhoda Odhiambo.